Okay, let's dive into this. Welcome everyone to a highly focused, highly efficient explainer on macrolide antibiotics. If you're prepping for the NCLEX, or honestly, if you just need a rock-solid pharmacology refresher, you are in exactly the right place. Today we're taking a really structured, visual approach to break down everything you actually need to know about meds like azithromycin and erythromycin. My goal here? Strip away all the fluff. I want to give you a crystal clear understanding of what these drugs are, how they work, and exactly what you need to watch out for at the bedside. So let's get right to it.
Here's our roadmap for today's explainer. We'll head 4 key stops. First, decoding the name. Second, targets and tactics. Third, the Lides demonic. And finally, patient care warnings. We're keeping it simple so you can focus purely on retaining the facts. All right, section 1, decoding the name. Because, before we do anything else, it's absolutely crucial we correctly identify the drug on an exam, right?
Now, what's really interesting about this slide is how it points out one of the most common test-taking traps nursing students fall into. It's misidentifying the suffix. Macrolides share this common suffix of therapeutic, but when you're rushing on an exam, you know how it is. You just quickly glance at the name, you see that MYCIN ending, and boom, you immediately think, oh, this is an aminoglycoside. Because yeah, those meds tend to end in mycin too. You literally have to look at the whole suffix. Look at the letters RO right in the middle of therapeutic. Where else do you hear that row sound? Exactly, in the word macrolide. That simple row-to-row matching trick is going to save you from getting confused and dropping easy points on test day.
Section 2, targets and tactics. Let's transition into the clinical application. What do these drugs hunt, and how do they operate once they're inside the body?
Well, macrolides are incredibly versatile. It's exactly why you see them prescribed so often. Think of the classic Z-Pack you might get at urgent care. They primarily target gram-positive bacteria, though they can go after a few gram-negative bugs as well. This makes them a fantastic frontline choice for treating things like respiratory infections, ear infections, and even H. pylori. Oh, and they're also highly effective against certain sexually transmitted infections, particularly chlamydia.
But how do they actually stop these infections? This is the cool part. They do it by targeting something incredibly specific, the 50S ribosomal subunit. By latching onto this exact 50S subunit inside the bacteria, macrolides effectively jam up the machinery. They severely inhibit the bacteria's ability to synthesize proteins.
So the crucial point is that because it merely inhibits protein synthesis rather than, say, destroying the cell wall, this drug has a bacteriostatic effect on the body. This means it stalls the bacterial growth. It stops them from multiplying rather than outright killing them on contact like a bactericidal drug would do. Essentially, it gives the patient's own immune system the time it needs to swoop in and finish the job.
Moving on to Section 3, the Lides mnemonic. We're shifting gears from what the drug is to how to safely manage it using the ultimate memory cheat sheet, LIDES. Let's move to and see how this builds. To safely manage patients on macrolides, you really just need to remember the word Lides. L for liver toxic, I for increased QT interval, D for drug interactions, E for eat with food, and S for superinfections. Go ahead and lock this table into your mind. All right, let's break it down letter by letter.
First up, the L. L stands for liver toxic. Macrolides can be pretty tough on the liver, so you need to proactively monitor your patient's liver enzymes, especially if they're on a long-term course of the medication. Then we have the I, which stands for increased QT interval. Honestly, this is a big one. You absolutely want to check their ECG to ensure you aren't prolonging that QT interval. Why? Because an extended QT interval carries a serious risk of pushing the patient into a dangerous arrhythmia.
In fact, you have to be extremely vigilant about what other medications your patient is already taking. There is a severe high risk right here. Listen, if your patient is using other QT prolonging drugs, like amiodarone for instance, and you add a macrolide on top of that, you are compounding the problem massively. Mixing macrolides with amiodarone drastically increases the risk of triggering fatal arrhythmias. You literally always have to check that medication list.
And that brings us to Section 4, patient care warnings. Let's finish out those last 3 letters of our mnemonic.
So we have the D, E, and S left. The D stands for drug interactions. Specifically, we're talking about how macrolides act as CYP450 inhibitors in the liver. Then the E stands for eat with food. Taking these pills on an empty stomach is notorious for causing GI upset. So definitely advise your patients to take them with meals unless directed otherwise. And finally, the S stands for superinfections. Now, outside of the hospital, super usually means something great. But in pharmacology, yeah, a superinfection is definitely a very bad thing.
And this brilliantly illustrates why understanding that D for drug interactions is so vital. Macrolides, particularly erythromycin and clarithromycin, inhibit the CYP450 enzyme system. Now, that system is basically the liver's metabolism machinery for a ton of other medications. If you inhibit it, those other drugs just build up in the bloodstream and become dangerously toxic. You absolutely must watch out for toxic combinations with drugs like warfarin, statins, and theophylline.
Finally, returning to that S. Superinfections happen because broad-spectrum antibiotics like macrolides don't just kill the bad bacteria. They basically wipe out the good flora in the body too. And when the good bacteria are gone, opportunistic infections just take over. You have to actively watch your patients for these cascading side effects. Things like C. diff in the gut, thrush in the oral cavity, and vaginal yeast infections.
So think about this. Tomorrow, when you're on the floor and your patient's chart shows they are already on CYP450 inhibitors, or maybe their baseline ECG shows a prolonged QT interval, missing the signs could literally be fatal. So will you remember the lides? Commit that mnemonic to memory, always check for that row in the suffix, and you won't just pass your exams, you'll actually save lives. Thank you so much for joining me for this explainer. Stay curious, keep studying hard, and I'll see you next time.